welcome to our special show. I'm Gargi Rawat. Parkinson's disease is misunderstood by many, and it can be difficult for sufferers to get the resources they need to cope with everyday life. Globally, disability and death due to Parkinson's disease are increasing faster than any other neurological condition. It's estimated that more than 8.5 million people worldwide will have Parkinson's disease, and after Alzheimer's disease, Parkinson's disease is the most common neurodegenerative disease. Despite advances in the treatment, diagnosis and care of people with Parkinson's disease, insufficient knowledge and related beliefs in the general population may play a key role in limiting access to appropriate treatment and care. The prevalence of Parkinson's disease is increasing, but fewer people recognize it. Parkinson's Disease Awareness Month is celebrated in April. Parkinson's Disease Awareness Month is an opportunity to raise awareness of the disease and its symptoms and to support those affected by it. World Parkinson's Day takes place every year on the 11th of April to raise awareness of Parkinson's disease. So today on World Parkinson's Day, we have with us a distinguished panel of experts who will help us understand this disease as well as its management. Let's introduce our guests now, and we're joined by Professor Kailash Bhatia, Professor of Neurology, UCL, Queen Square, London, Dr. Sanjay Pandey, Professor and Head, Department of Neurology and Stroke Medicine, Amrita Hospital, Faridabad, Dr. Hrishikesh Kumar, Vice Chairman, Institute of Neurosciences, Kolkata, Dr. Charulata Sankla, Senior Faculty, PD Hinduja, National Hospital and Research Centre, Mumbai, and Professor Ravi Yadav, Professor of Neurology, Nimhans, Bengaluru. Thank you so much all for joining us on this program and on this very, very important issue. My first question to you, Professor Bhatia, what is Parkinson's disease? If you could just explain to the viewers, and how does it affect the body?
Thank you. Yes, I think it's very important to bring awareness to this growing problem. So Parkinson's disease in a nutshell is a degenerative disorder of the brain. And the part of the brain which is mainly affected is a part which produces a chemical dopamine and also some other allied chemicals. And the loss of dopamine has a profound effect on the body, mainly with regard movements, what we call motor symptoms, but also some non-motor symptoms. But the hallmark feature for us, for the neurologist, is slowness or bradykinesia. And the other problem which happens is stiffness in the limbs. And Parkinson's seems to affect one side of the body more than the other side. So these are the motor features, and as time goes on, there is difficulty walking. But there are also a number of non-motor features which we recognize. These could include loss of sense of smell, constipation, tremor which leads to difficulty writing, and also the writing becoming smaller. And in many people, anxiety and depression and cognitive changes may occur in this disorder.
Professor Pandey, if you could tell us how many stages of Parkinson's disease are there?
So broadly, we divide Parkinson's disease in two stages. One is early stage Parkinson's disease and second is advanced Parkinson's disease. So in early stage Parkinson's disease, patient may have just mild tremor, mild slowness and mild stiffness of the body, that is known as rigidity. And along with that, patient may have some non-motor symptom like patient may have constipation, patient may have anosmia, or patient may have some vague pain and aches elsewhere in the body. When the disease progresses further, the disease becomes bilateral and the patient has features of advanced Parkinson's disease. And in advanced Parkinson's disease patients, the drugs response is not that good. And sometimes patient is chair bound. And if the disease advances further, the patient can be bed bound as well. And it's very important to realize that if the patient is treated early, then the progress to early to advanced Parkinson's disease can be slowed down and patients can be helped in a better way.
All right. Now, Professor Bhatia did speak about the symptoms of Parkinson's disease, but Dr. Hrishikesh Kumar, if you could give us more details about these symptoms.
There are many symptoms, but the core of symptom is what we call as bradykinesia slowness, the patient will tell us that what I used to do in say 10 minutes time, now I'm taking half an hour, 1 hour time. So they slow down in all activities, all the daily activities. So that is slow kinesis or bradykinesia. If there's any doubt, what we do or anybody can do to ask the patient to open close hand as fast as possible, as you see here. If they slow down in doing that, that we call as slowness. So that is the crux of symptom, core of symptom. Apart from that, they have tremor of the hand, mainly one hand more than the other hand, sometimes legs also. But tremor is peculiar. Tremor is not during the activity. When they hold a cup of coffee, that may be less at that time. But when they're sitting, rest tremor, we call as rest tremor, is more pronounced. Sometimes it looks like they're rolling the pill as the puja pill. So that we call as pill rolling tremor. So we talked about slowness, we talked about tremor. Then when the patient walks, they are stoop forward, bend forward. They take small steps like baby step. Sometimes looks like they have difficulty in clearing the ground. They scrape the ground or shuffle the ground. And then they have stiffness all over the place, mainly one side more than the other side. So these are motor symptoms, which are the main symptom. But again, mental faculty involvement, like cognitive involvement, anxiety, depression, sleep problem is very important. They have insomnia. And many times Parkinson's patient, before other symptoms start, they have problem in the sleep. During sleep, they shout, they speak. Sometimes they hit the partner. So that we call as sleep disorder. That can be there. But again, I'll come back to the main symptom, that is slowness or bradykinesia.
All right. Dr. Charulata, is it true that dementia is often seen in the later stages of Parkinson's disease? And for our viewers, if you could tell us what kind of dementia goes with Parkinson's?
Yes, surely. The dementia that we see in Parkinson's disease is not similar to what we see in Parkinson's. And it's very common as the disease advances, we do start seeing the changes in the cognition. But the cognitive changes occur even in the early and mid stages. We can see that the patients they get easily distracted, they're disorganized, they have difficulty in planning their day-to-day activities, difficulty in planning the tasks, they have difficulty in focusing their attention onto doing things, they're unable to multitask, they're not able to shift their attention from one task to the another task. Along with slowness of movement that Dr. Rishikesh just told you, there is a slowness of thinking as well. So these patients tend to respond late to commands when you are talking to them. They take longer time to talk or respond, and you feel that they've not heard your commands or they're a little slow. They have difficulty in completing their task in time. They have visual spatial difficulties, so they're not able to judge the distance. So when they go to sit in the chair, they tend to sit on the edge of the chair, risking a fall. When they're sitting on the chair without the arms, this is particularly evident. And in early to mid stages, sometimes they have difficulty in judging the space. They will find it difficult to park their car. As the disease progresses, the dementia worsens, they start seeing things, we call it hallucinations. They start seeing people, animal, their relatives, which are not existent. And then they start having paranoid delusion, they become suspicious. And these are the advanced stages of the dementia in the Parkinson's disease.
All right. Professor Ravi Yadav, how does Parkinson's disease affect men and women differently? If you could tell us about that. Is it known why there are distinct differences between the sexes when it comes to Parkinson's disease?
Yeah, the effects of Parkinson's in men and women is different in many ways. The large amount of data, epidemiological data, has shown that men are almost twice as likely to develop Parkinson's disease. And people have suggested that exposure to reproductive hormones like estrogen would be a factor. But we have to understand that there is a criticism about these studies which have been conducted at the tertiary care centers. And we know that men have more health-seeking behavior since they are the bread earners of the family. And so this data is taken by a pinch of salt, and because females do not usually, for example, in India, they may not go out and consult a doctor regarding this. Apart from this, there are several other differences. For example, if you look at the symptomatology, the women are more likely to have tremor-predominant Parkinson's disease, and apart from that, may have more of pain in the body, constipation, and swallowing problems. While men may have more likely to be skeletal problems like bending forwards, cognitive problems, and drooling. But overall, it's not black and white. Many things can occur in both the genders. But this is the main thing. And about the non-motor symptoms, like it was told earlier that the sleep problems, for example, violent dreams are more likely to be seen in men with Parkinson's disease, while in women it is less likely. And also anxiety and depression are more commonly seen in women with Parkinson's.
All right, so those are some of the differences. Professor Bhatia, now, is it true that Parkinson's disease is only seen in people of advanced age, and what are the causes of this disease?
Again, a very good point. We all are realizing that the prevalence of Parkinson's is going up, and this is thought to be because we are all aging more than we did in the past. So it's absolutely true that the classic Parkinson's, which we all know about, happens in an older age group, so usually in the 60s. But there are other forms of Parkinson's which can happen earlier in life, and we call that young onset Parkinson's disease or early onset Parkinson's disease. And it is more likely that in the early onset Parkinson's disease, there is a higher tendency to have a genetic factor. So there may be a gene which is causing the young onset Parkinson's, while in the older onset, the classic form, as we call it, the likelihood of a genetic cause is much less than in the younger onset. So although we would say that typically Parkinson's happens in the older age group, there are other forms which can happen at a younger age. There are a number of suggestions that it could be an environmental factor, something in the environment perhaps. It could be a genetic trait. But as I already said, in the large proportion, we do not find a genetic cause. Or it may be a mixture of the two. So you're carrying a genetic trait and somehow the environment also causes you to lose those brain cells in that part of the brain as I described, which produce dopamine. So if I had to sort of summarize and conclude, I would say, unfortunately, we still don't know the exact cause of Parkinson's, but a lot of research is going on in this regard.
All right, hopefully in the years to come, we will know more. With that, time for us to slip into a short break, but we have many more questions for our guests. Stay with us. Welcome back to our special show on World Parkinson's Day, where we're discussing various aspects of Parkinson's disease with a panel of experts. Well, let's go across to the experts. And Professor Sanjay Pandey, how do you diagnose a Parkinson's disease?
So the diagnosis of Parkinson's disease is mostly clinical. Like if the patient of a tremor walks into the clinic, the first possibility should be to think of Parkinson's disease if it is a rest tremor. And it's very important to emphasize that in Indian setting where anybody who has tremor, be it rest tremor or be it accent tremor, we think that it is because of aging. And like there is a say in the society that this tremor is a sign of aging or senile tremor. That is not true. So if anybody has a tremor that requires a clinical consultation, and if that is happening in the 50s or 60s, it's very important to rule out Parkinson's disease. So by this, I want to give a message very clearly and loudly that anybody who is developing a tremor at whatever age, please don't take it lightly and just try to consult your doctor, because that can be a sign of Parkinson's disease. Now coming to other diagnostic features, like in some of the setting, like patient may have a stroke, and following that patient may develop Parkinson's disease. Or if the symptoms are coming very rapidly or at a young age, maybe some investigation like neuroimaging may be required, but that is not the case in majority of the patient. And similarly, if the patient has a family history, some genetic testing may be required. And if the patient has some doubt regarding the diagnosis, sometimes we do advanced nuclear imaging study. But overall, the diagnosis of Parkinson's disease remains clinical and it's fairly straightforward.
All right, Dr. Kumar, now the big question, can Parkinson's be cured and what are the treatment options for Parkinson's disease?
This is an excellent question, and I'm not surprised because we hear this all the time. All the patient comes, they ask that what is the cure for that? I'll answer that at this point in time. There's no cure of Parkinson's disease, but we have understood quite a lot. And in the next few years, I hope that cure will be there. But I will stress a point here that we are more fixated towards cure. What happens in Parkinson's disease with treatment of Parkinson's disease, I'm not talking about cure, with treatment of Parkinson's disease, with the replacement of a chemical known as dopamine, patient can lead good quality of life for years and decades altogether. So they can remain active, they can do their daily activities, no problem at all. And the medication, the core medication again is dopamine, what we call as levodopa. The small medication, small pill, and you'll surprised to see that if you give to the patient, they do very well for next 3-4 hours, almost normal, at least initial stage of disease. So the treatment pills are there, replacement of dopamine and other dopamine-like medications. But there comes a stage when patient will have difficulty with medication also. They have what we call as frequent on and off. It effects comes for 2-3 hours and go. At that time, we use what we call as brain pacemaker or deep brain stimulation. That is surgery that improves the quality of life for a long time. Apart from medications, surgery, a lot of new things are coming up, like injection of what we call as apomorphine. So various treatment options are there, and that keep the quality of life for a long time. I like to convey one more time that I have seen patients that they come to us and they like to have cure. That's one. They don't understand that quality of life is very important and we can maintain that. And second, that many a times they don't want to start medication. They're suffering, but they don't want to start medication. I would convey that levodopa, which is a wonderful medication, if we delay, we are not gaining anything. We are just losing the quality of life. We are just losing the time. So options are there and we are moving towards cure. Hopefully in 2-3 years time, a few years time, I would say that cure may be there. Thank you.
Right, so hopefully a cure in the years to come. Dr. Charulata Sankla, if you could tell us more about the management of Parkinson's disease and what role does lifestyle modification play?
That's an excellent question. I always tell my patients that in addition to taking their medications, they also need to change their lifestyle. This is a movement disorder. That means there is a problem with the movement. So it's very important for them to move in any form and follow some exercises such as yoga, simple walking, cycling, swimming under supervision, tai chi, dance therapy. Any form of movement helps Parkinson's disease patients move better, in addition to taking their medications regularly. As far as the diet is concerned, healthy diet always is recommended, but we normally tell them to increase the fluid intake, that is the water intake, as well as the fiber intake, because these patients are very frequently constipated. And if you increase the fiber intake, this problem can be solved. Another thing that I also tell my patients is not to take their dopaminergic pills, particularly with the protein. It's a common habit of the Indian patients to take the pills with milk, with a glass of milk, and that causes the problem with the absorption of this particular chemical, which is helping their brain. In addition to all these things, I also tell them to maintain their social contacts, involve themselves with a lot of social activities. I tell their caretakers that they should attend all the social functions that are happening around them. So that keeps their cognition, and we talked about dementia, that delays their cognitive decline, and that keeps them more active and allows them to live a more independent life.
All right. Professor Ravi Yadav, so if you could explain to us, Parkinson's disease is a lifelong disease, and how long do Parkinson's patients live?
Yeah, this is a very important question. And several patients come to us and directly they ask us, the first question is about the survival. Now, yes, it is a lifelong disease, but there are several lifelong diseases which are actually treatable with the current progress in science. Hypertension, diabetes, hypothyroidism, so many. So it is, as the message has been clear by the previous speakers also, it is a treatable disorder. So rather than worrying about the long-term survival, we should worry about the treatment aspect. Second thing is, several of the studies have shown that the Parkinson's disease patients have a normal or near normal life expectancy with the current treatment strategies. So the most important thing is, because there is advancement in treatment of complications which can occur in advanced Parkinson's disease, the survival has become significantly better. Above all, if the patient is seen early, treatment is started early, and along with the holistic management of exercise, adequate nutrition, these other things and several consultation with the expert is taken regularly, overall the quality of life and the survival is as good as any normal person.
Finally, a question for all the panelists on World Parkinson's Day today. What message would you like to share with our viewers? And Professor Kailash Bhatia, first to you.
Yeah, I think the message would be, as you heard already, my message would be, do not lose hope. This is not doom and gloom. Nowadays, with good management, one can manage people with Parkinson's disease who can live a fruitful life for a very long period of time. So I think there is complete hope in managing and doing a good job in this regard. This is now available to everybody, and I think this is the main message I would give.
All right, Dr. Sanjay Pandey.
Yes, my main message is that patient should stick to one doctor when they are getting the treatment of Parkinson's disease, because it's a long journey. And I have seen patients switching their doctor and the medications very frequently. Following the advice of the doctors and sticking to one prescription is the main form of this therapy.
All right, very specific, advice there. Dr. Rishikesh Kumar.
Yeah, my message to public will be that Parkinson's disease patient, they don't need sympathy. What they need is understanding and support. And my message to employers is that once the patient has Parkinson's disease, that doesn't mean that they're not employable. They can remain productive for a long time to come. They're good medications. So just support them and they will make you feel proud. Thank you.
All right, an important message there. Dr. Charulata.
We talked a lot about the symptomatic therapy in the earlier sessions, and we talked about cure also. Although there is no cure right now, but there is a lot of research that is going on to find the cure of this disease. If we can't find the cure, at least if we can slow this disease, the progression of this disease, if we can halt the disease as to where it is, we will achieve a really big goal in treating these patients. And the research is going towards that direction. It's called disease modifying therapy. And let's hope that in the coming decade, we should be able to do something about it.
All right, so hoping for a cure soon, but at the moment we do have ways to, manage this disease, an important message there. And finally, Professor Ravi Yadav.
My message on World Parkinson's Day is to all the patients and all their carers. The current moment is a gift to you, and life is full of such moments. Enjoy it, embrace it, and live life fully.
All right, well, important points to all keep in mind, and thank you so much, doctors, for taking time out and joining us on this program to talk about these very important issues around Parkinson's disease. Well, that's it in our special show. Thanks for watching. Goodbye.